138/86. If a number like that showed up on your home monitor this morning, what does it actually mean? Is that normal at your age? Time to worry? Time to do nothing? Here's why this matters right now. About 7 out of 10 Americans in their 60s and early 70s have high blood pressure. And in 2025, the American Heart Association and the American College of Cardiology released a brand new guideline, the first full update in 8 years. So if your idea of normal comes from something you heard years ago, today is a good day to refresh it. And there's a second problem, maybe a bigger one. The number on your monitor is only as good as the way you measured it. Coffee, a full bladder, crossed legs, even talking during the reading. Each one can push the number up. Get the measurement wrong, and every decision built on it starts wrong, too. So today, 2 things. What the new guideline actually says is normal, at 60, at 70, at 80, and the official step-by-step way to measure at home. So the numbers you bring to your doctor are numbers they can trust. First, let me introduce myself. My name is Mitsu. I'm a registered nurse licensed in Japan, the country where people live longer than almost anywhere else on Earth. For more than a decade, I've cared for patients in hospitals and in elder care. And in those years, I have taken more blood pressure readings than I could ever count. Here's the promise of this channel. Everything I say comes directly from published medical guidelines and public health institutes. Today, mainly the 2025 Hypertension Guideline from the American Heart Association and the American College of Cardiology. Not my opinions. The exact sources are linked in the description, so you can check every word. One more thing, and it's important. This is education, not medical advice. I'm a nurse, and I'm not your nurse. Never start, stop, or change a medication because of a video. Any video. Talk to your own doctor first. Deal? Then let's begin. Let's start with what the 2 numbers actually mean, because most of us were never really told. The top number is your systolic pressure, the push of blood against your artery walls when your heart beats. The bottom number is your diastolic pressure, the pressure while your heart rests between beats. And here's something worth knowing at our age. The American Heart Association notes that for people over 50, the top number tells more about risk. As we age, the large arteries naturally stiffen, so the top number tends to drift upward. Common, but common is not the same as harmless. One more fact before the categories. High blood pressure usually has no warning signs. You cannot feel it. Measuring is the only way to know. Now the official categories from the 2025 guideline. Normal, below 120/80. Elevated, top number 120 to 129, bottom still under 80. Stage 1 hypertension, 130 to 139 on top, or 80 to 89 on the bottom. Stage 2 hypertension, 140 or higher on top, or 90 or higher on the bottom. And a detail people miss. These categories are based on your average. At least 2 readings, on at least 2 separate occasions. Never on one number from one stressful moment. One high reading does not put you in a category. Your average does. So, is there a special, looser, normal once you turn 60 or 70? You hear it everywhere. 140 is fine at our age. And here's the thing I want to be honest about. That belief isn't foolish. It used to be the rule. For decades, the official cutoff for high blood pressure was 140/90. Below that was called normal or borderline. So if you grew up believing 140 was your ceiling, you learned it correctly for that time. But in 2017, after a large body of new trial evidence, the major guidelines lowered the line to 130/80. What used to be called pre-hypertension became stage 1. And the 2025 guideline I'm using today keeps that very same line. So the honest answer to does normal change after 60 is no, but the standard itself changed for everyone. On today's chart, 140 is not a little high for your age. It's stage 2 high blood pressure at 40, at 60, at 80. There is no separate chart where 140 quietly becomes normal at 70. What about treatment goals? For most adults with high blood pressure, including older adults, the guideline supports a goal of below 130/80. And this isn't a target that stops mattering with age. In the largest trials, the benefit of lowering blood pressure held up even in people in their 80s, with no drop-off by age. The payoff isn't only your heart either. The 2025 guideline added a top-level recommendation. Keeping the top number under 130 is recommended to help prevent mild cognitive impairment in dementia. Your blood pressure plan is also a brain plan. Now the honest nurse-to-neighbor part, and this is exactly where that "some people do better with higher numbers" idea comes from. Most adults is not every adult. The guideline is clear. For older adults who are frail or who have serious illness and a limited life expectancy, doctors and patients should weigh the benefits and the harms together and may choose an individualized, sometimes higher, target. In the major trials, side effects of intensive treatment, low blood pressure, fainting, falls, did happen a little more often, but they were infrequent. So if your doctor sets a goal for you that's different from your neighbor's, that is not sloppy medicine. That is your medicine. Your job is not to pick your own target. Your job is to bring trustworthy numbers to the person who will. Which brings us to the part almost everyone gets wrong. Home readings are not a toy. The U.S. Preventive Services Task Force recommends confirming blood pressure outside the clinic before a diagnosis of hypertension is even made. And the 2025 guideline includes an official home monitoring protocol. Done right, your kitchen table numbers are real medical data. Here is the official way, step by step. Step 1. The device. Use a validated upper arm monitor. Validated means it passed independent accuracy testing. There's an official list at validatebp.org, linked below. And the cuff must match your arm size. Ask your pharmacist or care team to help you measure. Step 2. Prepare. No caffeine, no smoking, no exercise for 30 minutes before. Empty your bladder. Then sit and do nothing for 5 full minutes. Back supported against the chair, both feet flat on the floor, legs uncrossed. Step 3. Position. Cuff on a bare arm, never over a sleeve. Arm resting on the table, supported at heart level. The bottom edge of the cuff sits just above the bend of your elbow. Step 4. Measure. No talking, no phone, no TV. Take 2 readings, 1 minute apart. The guideline's schedule is twice a day. 2 readings in the morning, after you empty your bladder, before medication and before breakfast, and 2 readings at bedtime. Keep that up for at least 3 days. 7 is better, before a doctor's visit. Step 5. Record. Write every reading down, or let the monitor's memory store them, and bring the whole log to your appointment. That's the entire protocol. Not complicated, just precise. Now let's flip it. These are the everyday mistakes that make readings falsely high. Count how many you recognize. Coffee first, measure after. That breaks the 30-minute rule. Caffeine, smoking, exercise. A full bladder? Raises it. Perched on a stool with no back support, legs crossed, arm hanging at your side? The CDC points out that crossed legs and an unsupported drooping arm alone can push a reading up. Chatting with your spouse mid-measurement? Up. And the biggest one, judging yourself by one single reading. Averages, always. Here's something else your home log can reveal. Something a clinic visit alone cannot. Some people run high only at the doctor's office and normal at home. The CDC notes that as many as 1 in 3 people with a high office reading may be normal outside of it. The famous white coat effect. And the reverse exists too. Normal at the office, high at home, called masked hypertension. Sorting both out is exactly what home monitoring, reviewed together with your doctor, is for. One last decoding tip. Home numbers run slightly different from office numbers. In the guideline's own conversion table, a home average of 135/85 corresponds to about 140/90 at the office. One more reason to hand over the log and interpret it together, rather than judging alone at the kitchen table. What if your average lands in elevated or stage 1? First, that's a conversation with your doctor. Bring the log. Second, the same 2025 guideline lists lifestyle steps with measured effects on the top number, and they're bigger than most people expect. Cutting back salt, The guideline's optimal goal is under 2,300 milligrams of sodium a day, moving toward 1,500. Can lower the top number by several points. And here's the part made for this channel. Older adults tend to respond to salt reduction more than younger people. By the way, salt is also a player behind those 3 a.m. bathroom trips. I made a whole video about nighttime urination. Same body, same salt. Link above and in the description. Then the rest of the menu. An eating pattern rich in fruits and vegetables. 90 to 150 minutes of exercise a week. In the guideline notes, structured exercise is safe even for older adults with hypertension. Less alcohol. Modest weight loss if your doctor recommends it. Each carries its own measurable drop, and they stack. What they add up to in your case, and whether medication belongs in the picture, that decision is your doctor's job, with your log on the table. And if you've also noticed swollen ankles lately, swelling has many possible causes, from veins to salt to certain medications. And I've made a full video walking through what the guidelines say about swollen legs and ankles too. Link in the description. Now the serious part, and please remember this one. If your monitor ever shows 180 over 120 or higher, wait a minute, breathe, and measure again. If it's still that high and you feel otherwise fine, contact your doctor's office right away. Today, not next week. But if it's that high and you have chest pain, shortness of breath, back pain, numbness or weakness, a change in your vision or trouble speaking, call 911. In the American Heart Association's own words, do not wait to see whether your blood pressure comes down on its own. And whatever your numbers are doing, never stop or change a blood pressure medication on your own. Dizziness, side effects, cost, those are real problems with real solutions, and every one of them starts with a call to your doctor, not with skipping pills. This week, one assignment. Tonight, check 2 things. Is your monitor validated, and does the cuff fit your arm? The link is below. Tomorrow morning, before coffee and before pills, 5 quiet minutes, feet flat, back supported, 2 readings 1 minute apart. Write them down. Do that for a week, and you'll hand your doctor something better than a guess. Evidence. So tell me in the comments, what number did you grow up believing was normal? I read everyone. If plain English guideline explanations help you, subscribing is the best way to see the next one. Take care of yourself and measure before the coffee tomorrow.